The next patient you will see is a housewife from Canada, just below the Arctic Circle. How she found her way to my office in the Washington, D.C. suburbs is beyond me. For the next few minutes, you will see footage taken by this woman's husband in their home several months to years prior to coming to see me. These patients are frequently institutionalized or warehoused because no one takes the time to diagnose or treat them. As you watch this footage, think that if you do not treat these patients, who will? They have seen multiple healthcare providers, sometimes as many as 65 healthcare providers, and they have received non-diagnosis after non-diagnosis after non-diagnosis, or outright misdiagnosis, time and time again, because no one has taken the time to do the proper workup. Some patients have been labeled as suffering from demonic possession. Actually, these cases are very easily treated if you just persevere. This is the patient's second visit to my office. I saw her about 2 weeks previous to this, at which time I rebuilt a lower appliance that some other dentist had made to give her relief, and took impressions for a new appliance which I would then make and deliver it during this appointment. At that first appointment, we also did a thorough diagnostic workup to include tomographic imaging and MR imaging. You're back to the
land of the living.
Yeah.
I just get, like I'm fading off,
Yeah.
It's one or two things that you just, bam, it just hits me, or everything just like I'm pulling away. I can't hear anything, it's just like drifting off into sleep.
Like an out-of-body experience.
Yeah. Out of chair.
Yeah. How frequent does this happen to you?
Twice a week.
Twice a week?
Yeah.
For how long has it been going on?
Oh, before that, before I started seeing you, it was daily.
Daily.
And it's been going on 4.5 years.
4.5 years.
Yeah.
But since I made that provisional appliance for you, or redid one of your old appliances, it's gotten better.
It's gotten better. They're not as severe, and they're not as frequently.
Can you put a percentage on how much better they are, if you could put a number on it?
I would say it's improved by 50%.
Okay.
60. They're not as powerful.
Yeah.
Actually, it's probably higher because it's not as debilitating. Probably 80% improvement.
And that's just with one visit, remaking your old appliance. Huh? Well, hopefully we'll get the remaining 20% with this new one that you have. What? To this patient, and I am going to adjust the occlusion on this patient so I have 1 or 2 point contact with her first and second molars. This is what it looks like, and I will lighten this contact slightly and lighten the second molar contact slightly. Notice the tori built into the appliance to keep her tongue elevated and her throat open and increase the oxygenation. Okay. Essentially, this is the delivery appointment of my first appliance. It is reinforced with a lingual bar. There is also steel reinforcing beneath the occlusal surface. To make sure the tori are the right size and will not impinge on the space needed for the tongue, we coat them with PIP or pressure indicating paste. The same paste you use when you're making dentures. And have the patient swallow. Swallow normally as fast as you can, about 1 or 2 swallows, that's all. And then say the words Boston, say the words,
Boston,
Mississippi,
Mississippi,
66,
66,
churches,
churches,
judges.
judges.
Those words contain all the sibilant sounds in the English language. And now we look to see if the paste has been penetrated, and you can see it has in a few spots, which we will now relieve. I repeat this process until there are no pressure areas showing up. Usually you need to do this only 2 or 3 times. Okay. Boston,
Boston,
Mississippi,
Mississippi,
66,
66,
churches,
churches,
judges.
judges.
There is still some pressure in the lingual areas, which we will continue to relieve. My appliance is out of her mouth, and you can see the reaction she is having now without the occlusal support. Intervals like this will become fewer and fewer as treatment progresses. I am putting the appliance back in the patient's mouth and having her seat it to place. Notice the immediate reaction that she has once it is in its proper place. You did it again. You're scaring everybody.
Thank you.
Quick enough for you, Doctor?
Quick enough, very quick enough.
Okay. Let me see you this afternoon, okay? A few minutes later, the patient wanted her appliance polished a little better, so I took it out of the mouth, and this is the reaction that happened shortly thereafter. Evidently, my appliance was not adjusted as well as I thought it was. I am switching my appliance with her original appliance that I had rebuilt, and then I am going to go adjust my own personal appliance even further for this woman.
Just wanted to ask you when it starts, I get this blinking,
Right.
or if there's too much sunlight coming in, or flickering lights, it sets it off.
Oh, okay. Yeah.
That's a
Trigger.
trigger.
Yeah. Photophobia. Okay, is that what you feel is doing it now? The lights, these overhead lights? I can't
I
tell.
don't know. I think just the jaw movement and pressure and, in and out. That's probably what's setting it off now, or head back.
Okay. Get me some new. I'll recheck the balance on this. Okay, let's just switch them. Okay. All this time, she has been wearing her old appliance, and now I've just put in her appliance that I made. Okay. Notice her reaction to the appliance being out of her mouth is not as severe as it has been at other times, nor has her response to the noise of the drill.
Feels good. It's just, once it gets into that mode, it takes forever to come.
Well, let's see you get up and walk. And
Do it again, but
yeah.
sometimes walking is. Not an option.
Not an option, okay.
No, it's not gonna.
As you can tell, the appliance is not as good as it should be. You can immediately tell how effective the appliance will be. You don't have to say, come back in 2 or 3 weeks and report to me.
Would you like to lean back? Do you think that may help?
No, that makes it worse. If I go forward, it's usually better.
The patient is hanging her head forward to move her mandible downward and forward. This decompresses the tissues of the temporomandibular joint. It's a form of mandibular advancement that the patient has serendipitously discovered.
Usually my right foot in the morning will cramp, and then I know I'm going to have a rough day.
That's your first sign in the morning?
Well, one of it's cramping now. It was this morning before I came in. The arch of the foot, and it's been that way for 4 years. And if the arch of the foot starts,
So it's not the toe, it's the actual...
the arch, yeah, it's just like getting a Charlie horse in the arch. And that's usually, that's one of the signs that sometimes I have nothing. I just, I'll do that blinking, and then I know that I'm in trouble. Or I'll pull away, I'll get that kind of distant, just like everything's just pulling away, like I'm going to pass out.
You want to try walking with that appliance in now? Seems to be...
Yeah. Okay, now.
You can see that with this old appliance she's improved, but her posture's not straight. Her head is still tipped forward.
This one's okay.
That feels good, huh?
Yeah, that's okay.
I guess this comes under the heading that any improvement is better than none at all, but is still not good enough. I increased the height very slightly, approximately a half a millimeter on each side, and just reseated the appliance for the patient, and this ends her appointment this morning. I'll see her again this afternoon to make any additional adjustments. What you want to look for when the patient is walking is that they walk with their feet straight ahead and not one foot straight ahead and the other foot splayed out to the side. Okay. Turn around and walk forward. Having the patient walk back and forth resets the nervous system. It's the same as tapping the teeth together. We have just fitted this patient with an Alpha appliance, which does a cranial adjustment 24/7. As long as it's in there, it will correct the malposition of her cranial bones and then hold them in the normal position. Whenever you deliver an Alpha appliance, the very next step is to balance the lower pivot appliance to the upper Alpha appliance, which is what we're doing. Tap, tap. You use thick Bosch articulating paper to get good markings. You remove the appliance, check your markings and rebalance it. That's already shifted. Can you?
Yes.
Yeah.
Absolutely.
You know, all these management people say never hire family two sisters because they can gang up on you. But what I do is get the older one and pick on the littler one.
Chop, chop.
Just rebalance the appliance 2 or 3 times until you have marks of similar intensity on either side. You can have both first molars hitting or all 4 first and second molars hitting.
It's great.
Okay, now get. No, we couldn't take the picture. She couldn't get it full. This is the patient as she returns 6 to 8 weeks later. Notice the head movement and the decline in her well-being. Her appliance has been worn down in the previous 6 to 8 weeks and needs to be rebuilt. Notice where this appliance has been greatly worn from chewing. This is why the patient's symptoms have returned. We're going to rebuild this appliance by the addition of fresh acrylic now. I have adjusted the patient's lower appliance by building it up, and notice how steady her head has become. This occurred within seconds after inserting the appliance. Now I'm going to take the lower appliance out. Notice the movement that begins once the appliance is removed. Now the upper appliance is out of balance and I need to adjust it, so I'm going to remove that also right now. Adjust it as quickly as I can and then reinsert it. See the difference having this upper appliance is made? Tap your teeth together. The removal of the upper appliance and the reaction subsequent shows the benefit that the upper appliance is providing. It needed to be adjusted because her temporal bones were still not completely aligned. Having made that adjustment and reinserted it, you can see that the movement diminishes. Now give me the lower appliance. We'll put in the lower appliance now. Tap, tap. We have the patient tap her teeth together about 5 or 10 times hard, which resets the cranial bone system, and the patient begins to return to normal. We go around to the back, check the level of the mastoids, and they are completely level now, and so are the occipital bones. And that's why you see the improvement in the patient.
The patient forgets how bad it was.
That's just to remind you. That's just to remind you what we're doing for you.
Sometimes you need a flashback.
You do. You do.
Life as it was.
Life as it used to be.
Thank you.
Okay, that's all right. As you can see, it takes both appliances, not just the upper and not just the lower. For the finest results, you must use 2 appliances, because all of these patients of any chronicity at all have cranial distortions, which must be eliminated. You can see how the patient responds to treatment, which is directed at structurally realigning her mandible to a correct maxillomandibular relationship to the base of her skull. This is the patient on a return visit with a paralyzed left arm, as well as other symptoms. I do not know what caused the paralysis, but it really doesn't matter, because I know how I'm going to treat it for her to regain use of that left arm and eliminate all these other symptoms. The appliance is out of her mouth now. Notice her reaction to the noise. Not high enough. Okay, give me here's hubby here. Okay.
Just like I started to just black out, just like lose every, just drop.
Okay. Okay. Is that a better height for you? I just adjusted it while you were out. I'm just...
Yeah, it's better.
Okay, you're coming back now? You're
Yeah.
coming back?
Yeah.
Okay. The patient also regains her ability to speak. It is extraordinarily frustrating being unable to speak and express yourself properly.
No.
Her reaction to the noise is much less now. Tap up.
Feels better. That's better. That's good. I can tell right away.
I know you can. Okay.
That's good.
Sit here for a while now.
Don't move.
The reason the patient can tell things right away is because we are dealing with reflexes, not disease. Good. Okay, that's great. Give me a hug.
Always. You're the best.
I want to get my hugs from you. Tell us how the last 6 weeks have gone since we saw you and adjusted your appliances.
The last 6 weeks have been absolutely great. I haven't had any, well, I've had a couple of little episodes, but nothing like it's been. And I have been feeling fabulous. I've started actually rowing, and slowly, but doing things that I haven't done in years. first, and I feel great.
All your friends and family members have noticed a difference in you?
Absolutely. I have entertained, which I haven't done in a long time, and they're just astounded by how great I look and I feel, and I can do things that I couldn't do 6 weeks ago. It's been a really trying 6 weeks, because as I was saying, I lost my dog of 12 years, and there's been a lot of emotional stress, and I thought, oh, normally that would cause a lot of grinding, but I weathered the storm, and I've been feeling really, really good. So.
Okay, I'm going to put your appliance back in. I have just resurfaced it a little bit and balanced it. And we're going to ask the patient to get up out of the chair and walk up and down a little for us so you can evaluate her. Want to take off your sweater there? Yeah, just so okay, just walk up to the end. Okay, and back. You can walk back from here. Yeah. And do it one more time, please. Excellent. Okay, have a seat in the chair. This is the appliance the patient has been wearing. It is a lower pivot appliance. Notice the one-point contact on either side, indicated by the blue ink, where the mesolingual cusp of the upper first molar occludes. This is the only cusp on the upper that touches this lower appliance, once on each side. Notice the two lingual shelves here, which are designed to elevate her tongue and reposition it upward and forward to open up her airway and to control the reflexes that go between the tongue and the brainstem. This is why the patient responds so readily to treatment.